Hi everyone, welcome back to Inner Power Psychiatry, where we explore the intersection of mental health, aging, and wellness. Today, we're diving into a deeply important topic, Alzheimer's disease and mental health. This isn't just about memory loss. Alzheimer's changes how a person feels, behaves, and relates to the world, and it affects the entire family. Alzheimer's is the most common form of dementia, a progressive brain disorder that slowly destroys memory, thinking skills, and eventually, the ability to carry out simple tasks. It usually affects people over 65, but the emotional and psychological effects begin much earlier than most people realize. Let's talk about how Alzheimer's impacts mental health, not just the person diagnosed, but their caregivers too. In the early stages, many people are aware something is changing. They might forget appointments, lose their way in familiar places, or struggle with finding words. This leads to depression, anxiety, and even fear of what's to come. They may ask, "Am I losing myself?" And that's a heartbreaking feeling. As the disease progresses, personality and mood changes become more obvious. A once gentle person may become irritable, withdrawn, or even suspicious. Some may experience hallucinations or delusions, believing others are stealing from them or seeing things that aren't there. This isn't just memory loss, it's a shift in how the brain processes reality. And let's not forget the caregivers. Spouses, children, and family members often suffer from emotional exhaustion, depression, and even burnout. Watching someone you love fade away is painful, and carrying the daily burden without support can feel overwhelming. The good news? We can support both patients and caregivers with the right approach. Depression, anxiety, and even psychosis can be treated. Doctors should use tools like the Geriatric Depression Scale to catch these early. Talk therapy, music therapy, and even art can reduce agitation and improve quality of life, especially in early to mid stages. Sometimes medications like antidepressants can help, but antipsychotics should be used very cautiously due to side effects in older adults. Join a support group. Ask for help. You can't pour from an empty cup. Taking care of yourself is part of taking care of your loved one. Even before Alzheimer's begins, we can take steps to support our mental health and reduce risk. Stay socially connected. Eat a brain-healthy diet. Exercise regularly. Manage stress. Treat depression and anxiety early. Your brain and your emotions are deeply connected. Alzheimer's doesn't just steal memories, it impacts identity, emotion, and connection. But with the right care, compassion, and support, people with Alzheimer's can still live meaningful, emotionally rich lives. And their caregivers don't have to walk this path alone. Thank you for watching Inner Power Psychiatry. I'm here to help you and your loved ones find strength, hope, and healing at every stage of life. See you next time.